joining us on Cool, the podcast that explores intersections of inspiring technology, fascinating people, captivating stories, or a combination of all three, and I think we have that today. So get ready to embrace your inner cool kid as we go behind the scenes with today's innovators and storytellers. I'm your host, Cameron Kitt. I am the founder and CEO of You Own Your Own Stories, which is a documentary storytelling company. And today we have the privilege of chatting with Dr. Daniel Gerscovich, or just Dr. G. He's a tech-forward orthopedic surgeon based out of Spartanburg, South Carolina. Dr. Gerscovich, thanks for coming.
Thanks for having me. Super excited.
So normally I start these podcasts by asking like, oh, were you a cool kid? But with an orthopedic surgeon, I'm not going to ask that because I already know you were like probably you played sports and were cool, because the answer is supposed to be no, right?
The answer is probably somewhere between. Yeah, I mean, orthopedics kind of envision the athlete, the jock, but honestly, doctors are all really nerdy, and I embrace that.
Wait, doctors are nerdy?
Oh yeah, if you
but
can't
not
embrace
orthopedic
that,
surgeons. Yeah, exactly. Yeah, you guys can't see this. He's nodding. You guys are out there on like you're like windsurfing, doing bike races.
Yeah,
deep sea
that
diving.
feels yeah, it kind of fits a little bit. It's a little bit more dip. Yeah, I can't actually argue that.
But it makes sense because typically the pipeline I think we talked about this a little bit. The pipeline is from athletics to helping people with their joints and living longer, and I call it living bionic. But the reason that you're here today is that we want to talk about the cool tech and the cool stories, and that you're someone who is nominated because of your not just acceptance but your openness to incorporating robotics into your practice. And I want to start off this show by asking you about a memorable patient story that has to do with that moment of integrating robotics into your practice.
When I started using robotics, it was quite literally jumping off a cliff. I didn't know what to expect, what we're going to get from it. Am I going to like it? Are my patients going to like it? Where is this going? I just knew that it was better than what we had before to give us more information than we've ever had. And that's just where can we go from here? And so I kind of just made the plunge without any hesitation, and it was awesome. When it comes to the patients and kind of what they get back from me, I get incredible engagement from the patients. They like having that ability because it is 2025 to look at your phone and your phone says, hey, Mrs. Smith, you're doing great. Keep it up. Or contrary, you're a little bit behind. Let's work on some exercises. Or it'll send me an alert and say, Mr. Smith is a little bit behind the eight ball, and we can work on that. When it comes to really that one moment that I was like, gosh, this is really, really cool. It comes to mind, a patient of mine on the older side, and we had done one side, and she had a really long recovery. Didn't have any issues, just kind of took longer than I would have hoped, and I think she would have expected for recovery until she really got good. It was well over a year. And so she was a little bit gun shy when she wanted to the other side, as was I, knowing that, she just didn't seem like she was really crushing it, so to speak. But she got over the hump. She's super active. She's a teacher at our local deaf and blind school. And at 83, she still, with her husband, travels the world and they hike mountains. And she hadn't been able to do that with her first knee since. And so she was she knew that she wasn't doing great with the other knee. She wanted to get it done. We agreed. She did the knee. 3 months later, she sent me a screenshot on the top of Mount Mitchell, which is North Carolina's highest mountain. That's 6,600 feet. And then when I was excited, and she said, I'm doing great. Both knees are awesome. And then we got back. I actually looked at all that data, and it was just incredible to see how just the slow progression, doing okay, getting better, getting stronger. And then I just saw this skyrocket with the fact where like the day where she was climbing a mountain, and it's like, wow, this is incredible. This is technology I never knew. And so when someone says, hey, I climbed a mountain yesterday, thank you for doing the knees, they're great. Well, now I can actually look at something and be like, you just did 40,000 steps. And that's incredible.
I've never done 40,000 steps.
One of the first times.
Yeah,
maybe this week I'll hit that.
Yeah, never once in my life have I done that. Like, I do really aspire to being that level of active, right? When you have more time in your life, like that's the stuff that makes you happy. But what's interesting is that you actually saw the mountain, like on the graph. right?
Yeah, I hadn't even put that two together. I did. I literally saw the peak.
Yeah, I always hear from I talk to a lot of marketing managers and directors who talk to doctors, and I always hear the same thing. Like they're very analytical and they want to see the data and they just want to see the data in the white paper. My job is always to be like, no, they need stories too. But what you're telling me is basically proving them right, which is like you really like seeing the data. Is that right?
I'll be honest. When I speak about this technology to other surgeons or even colleagues or partners for that matter, a lot of surgeons, especially at this time in their career where you've done a ton of research to get here, a ton of data synthesis to get here, you're kind of you need to stay on top of the research, the literature, the technology, in my opinion. But also, it can be a little bit overwhelming or if just time consuming. The best part about the technology is as I mentioned, kind of jumping off a cliff right into it, is it didn't take long at all to really understand and pinpoint the important parts. Um, and the app that I utilize has made it super easy in that it's a sliding scale. There's red, green, and blue, right? And red is bad, blue is okay, and green is good. And so I can literally just open it up and say, okay, she's doing great, or he's doing great, or vice versa.
What makes it red?
If a patient is falling behind their metrics, and so
Mm-hmm.
in my world, um, we measure what we call PROMs, patient-reported outcome measures, and these are abilities so that we can understand how the patients are doing. It comes with exercises and goals and checklists, essentially of their progress. And so, if a patient falls behind that in any way, um, or they were doing really well, and then
Mm-hmm.
boop, you saw a big dip. That would be a flag that would get red. I would be notified. Um,
Like they're not moving.
right, or for whatever reason perhaps they're just not being as active as they can. Maybe it's a pain issue. I had another patient that was just crushing it, doing amazing numbers off the chart in a good way, not an overachiever, but really doing really well. And he unfortunately contracted COVID. This was probably again one of my earlier ones, and it really worried me because numbers were great, following it, and then one day numbers gone, just gone, flatline, and it worried me. It's like, is it not working? Is it not communicating? So I texted him. He said, "Oh yeah, I got COVID. I'm in the hospital. They won't let me do therapy." So I was able to text the therapist and say, "Yeah, please let him walk. This is okay."
Because
And everything
because
went back to normal.
managing recovery is a big part of your job. Is that right? Like
Sure.
seeing patients
Absolutely.
coming back in, making sure they're doing everything because it's a two. It's not like once the knee is in or the hip is in, it's over, right? They have
Oh
to
gosh, no.
work
Yeah,
on it.
I
They
mean,
have to do
it's a
tons of
lot.
PT. Yeah, it's like a long and
Absolutely.
sometimes people don't like knowing that it's going to be 6 months or 3 months or however long before you feel good again or feel normal again or whatever. It is a major surgery.
Certainly.
I think we can go ahead. It's I'm okay if you want to say like this is it's robotic surgery, but also we're talking about the Persona IQ from Zimmer. Is that
Yes.
okay? Like I
Yes.
think it's okay to call
The
it out and
world's
say like,
first and only smart implant.
yeah, like I'm here for cool because like I think that's really cool, and I think you're somebody who's actually seeing that usage on your side. And seeing like the benefits. I want to step away from that for a second and just say like let's go back to the beginning of your career. Since you started
Certainly.
being an orthopedic surgeon, what's the biggest plot twist you've faced in this career?
I think it sounds kind of vague. It almost sounds like I'm trying to answer questions on a resume, but it is learning as a person
Hmm.
as you go through it. And it does sound generic, but I learn every day about myself, about my patients, about my field. And when you come out of training, you kind of have this mentality. I think a lot of us do, at least. I certainly did. That I feel ready. I'm good. I know I'm not the best. I'm not the hot shot. I don't know everything, but I'm ready to do this. And it's very humbling in your first year to understand you do not.
Hmm.
Or better yet, something comes along that you haven't seen, you haven't tackled, you've
Mm-hmm.
read about, but you haven't experienced. I think that is one of those moments that um, those those moments are still very humbling to me.
Okay, so after 7 years of training, the plot twist is like you're still going to be learning forever, and you have to be constantly open to that, and that
Yes.
you don't just have it locked in and you've gotten certified and you're going to be good forever. Um,
No.
what is it about
And
you that
even
yeah made you more open to trying some new technology, whereas other people might be hesitant to adopt something that's different?
that exact thing we just mentioned. the
Learning.
learning aspect of it.
Yeah.
It sounds very nerdy. There it is. I accept it. I'm a little bit of a nerd, but still, nevertheless, it's a situation where I thought I was doing great, and I thought I'm doing well, and surgery went great, high fives, backflips. Let's do this. Um, and then you see the patient at 2 or 3 weeks, and they're not doing well,
Mm.
and then it makes you wonder, well, is it my surgery? Is it the patient? Is it instructions? Is it education? Am I not connecting well? Am I not providing enough information for their best outcome? Well, all that seemed to just kind of fall in my lap when Persona IQ and the app that I also use called My Mobility was introduced. I thought, wow, this is all just in your hands. And better yet, it's 2025. We should be using apps. I mean, you use your app to order a pizza and get it here in 20 minutes, to call an Uber and go to the restaurant in 15 minutes. How
Or
come we're not using the
use
app
your
for our
Apple
recovery?
Watch. Yeah,
Exactly.
we already
It's a
are
Fitbit.
tracking things. Like my sister uses this thing called the Whoop. Are you aware of the Whoop?
I'm
Where it like
not.
gives you a
No.
sleep score. I'm terrified of this because I don't want to know what my sleep score is. Like I don't want to wake
No.
up and see like a 27. I'm terrified of that. But like we already there's a lot of people who are measuring their own biometrics for improved life.
Hmm.
Like for instance, me and my boyfriend do compare steps, and that's why I have a walking desk is because I'm always woefully behind, and I'm like the app is sexist. It's not measuring my female steps. Um, but
It's
yeah, like
shorter
I find
steps.
this
That is real.
we don't know, but the truth is like this what's so interesting to me is like from thinking about it from your perspective, once the patient leaves and you've been doing backflips, once the patient leaves there's this black box. Like you don't know what's going
Mhm.
on with them until they come back in and tell you. So now you have this kind of ability to check in and you have an app that kind of will flag things. Does it create more psychological safety for you around your
Yes.
patients? Yeah.
Yeah. Not only for me to understand that, I can directly follow a patient, excuse me,
Mhm.
in their recovery, but also they can do it too. They're as much engaged as I am, and well, hopefully so. I mean, of course, there's some who are a little bit more engaged than others, but our research has proven that if those patients who know more and have more better education and better engagement will do better. This the same way I always equate it is, you get in the car and you type in your GPS and it says 2 hours. I'm going to get there in an hour and 50 minutes. I'm going to do it. Well, the same way these exercises and these scores are, I feel, are for patients that, okay, you need to meet 10,000 steps today. Well, let's do this, because you don't want to look at your app and have it in the red.
Yeah, and like knowing that I can look and check gives me power in this world where we are driving more towards patient-centric, patient-powered outcomes, patient-powered healthcare, putting them in the driver's
100%.
seat. I think
And
this
as a
is
matter of fact, it's actually becoming,
yeah.
those are now regulations. We have to collect this data under
Huh.
Medicare. And this is all just built in. And so it's for me, it was, when this came about, my partner was all upset and how am we gonna do this? How do we integrate this? This is so annoying. And I just said, if you use the app, it's already done for you.
Mm-hmm.
And it's no cost. It's nothing extra to you. You benefit from it 100%. And if you benefit it, you have to imagine your patients are going to benefit from it. And that's what I've seen. That's really where this has taken me. That I can't believe it hasn't been done prior. I don't
Yeah.
know why this is. It's incredible that the technology took this long to get, but it really took a brilliant mind and a lot of work to get here. And I'm never looking back.
I mean, it does seem like a no-brainer. Like what blew me away when I first started looking into this space and working in the space was like I truly thought that the like robotic assisted surgery would scare people off. And what I heard over and over is like that is not true. Patients are stoked on the robot. And I was like, oh, I thought people would be afraid of it. Like that one just surprised me. But the truth is, like in this situation, more data is a good thing, and more information, more
Yeah.
awareness. From a general standpoint, I'm talking to a doctor, I'm talking to an orthopedic surgeon who's going to see a percentage of people in this population. What do you wish people knew? Like if you could wave a magic wand across the whole population.
Know about what?
Just like
About the
I'm just truly
recovery?
thinking from a
About
doctor, like okay, know about their joints, know about taking care of themselves, know about like surgery, whatever. There's got to be something that you wish everyone knew.
that. That's a great question. What I would say is I hear all the time, um, I wish I'd done it sooner, or I was told I had to wait, I was too young, or I've just been suffering for 5 years. I think it would be, I think it's up to the onus as a surgeon and in our field to say there's no reason to be living a decrease in your quality of life with increased pain when there are treatment options that are extremely successful.
Love it. I wish people knew that suffering is not noble.
Yes, it's not, and it's so humbling, and always puts a smile on my face when someone comes in and says thank you. And again, that sounds very cheesy, but it really makes me feel like we're doing it for the right reasons. When someone has trouble just going to the restroom or getting out of a car, there's a treatment option that can fix this.
So why do people feel like they don't deserve it? That's what I want to know. Like, I think there is this
I think it's
situation where
fear.
we like expect that we have to be in a certain level of pain before we deserve to treat it.
The old adage was definitely wait. You're too young. Deal with it. Take some
Hmm.
Tylenol. Wait till you last need. Well, our technology's improved. Our techniques have improved. Our understanding's improved. Where now we expect longer longevity out of our implants and our surgeries. Um, and with that, there's just no reason to be living in pain. There's no reason to be waiting. Um, yeah,
I wish people knew that when it hurts, it's time to go see the doctor.
They do. But again, I think that to piggyback on that, I think it is fear. This is we in this country will do 1.5 million, probably at least, total knee replacements, um, and you will not hear of 1.25 of those. But the other 250 that are painful or have a complication, or that's what you hear about. And so I have definitely had patients who come in and said, my neighbor or my friend from church had this, that, and the other, or still has pain, or stiff, or this. And there's a lot of factors involved, but that's pretty scary to consider going for an operation for a permanent implant and not getting 100% outcome.
Ah, yeah,
So
that
I think
reminds
that
me of
might
this.
be adding to some of that. I
That's a good
believe,
point.
yeah, I believe
It's a
that's
good
probably
point.
contributing. Hadn't
I
thought of that.
remember a friend in the restaurant industry would always say, like, 10 people have a great meal, they don't tell anybody. One person who has a bad meal tells
Mhm.
10 people.
Yeah,
And like that,
and
we're like
now,
primed for negative stories. And for instance, this woman who
yes,
went hiking, it's very unlikely that she posted on Instagram, like, thank you so much, Dr. Gerscovich, for my new knee. And now I'm hiking
yeah,
again. Like, it's not likely that we will say that naturally,
right.
right? Because we want to hide
No, it's
that
100%.
perhaps.
One negative Google review is read 1,000 times, and you skim over the 5 stars because okay, 5 stars, that's a good spot, but then you want to read that 1 star. Say, I saw a rat in the kitchen. No one's going to go to that restaurant,
Then it's
and
over.
so the same thing, right? You might as well close up shop. And I
Yeah,
think
but
the
in New
same
York,
thing
we're just like,
happens.
I'm going to pretend I didn't see that.
Oh yeah, they're sitting with you.
Yeah, they're out there.
Um,
We're just going to let that one go. It depends on how good the food is.
yeah, just to look away. But I think that's a big part of it. I think people, unfortunately, there's obviously fear and trepidation with surgery.
Hmm.
Um, but surgery now is incredibly safe. Anesthesia is incredibly safe, but also people hear about the recovery, and when it comes to your placement, it's a hard recovery. There's no such thing as a painless knee. Um, it does happen. I see them. They do an excellent, but for the most part, yeah, you have to manage the patient and get them along and work through the expectations. And the first couple weeks are certainly hard, hips and knees. So that might be an element why maybe people are a little bit hesitant to go forward.
Do you ever have a situation where people don't expect the post-surgery pain?
Absolutely.
Because I feel like I would be one of those people that somehow like doesn't think the rules would apply to me.
No, everybody's equal when it comes to that. And there's certainly on a spectrum. I have patients who, day one are just taking Tylenol. I have patients who, um, need a refill of their pain medicine more than once. And
Hmm.
my goal as a surgeon is to try and minimize that as best I can.
Hmm.
Going back to technology and robotics, I personally think that it does deliver a better option as far as less manipulation of the joint during surgery, which is inherently going to cause less pain.
Hmm.
Um,
Wait, because of the robotic assistance?
it's more of the, and this is just my
Oh
own
yeah,
thought,
this is what.
but more of the fact that we are manipulating the joint a little bit less than when we do a manual knee or when I did a manual knee, um, and
You
then
mean
more
like cutting it?
non-robotic. Yes, non-robotic. as
Okay.
the lingo goes. And then also the precision, the accuracy, the stability, making sure the knee right from the start is as good as you can get it based on the way that you balance the knee. And I believe all that has progressed, again, in my practice to better outcomes. I see better range of motion, less swelling, less pain at 2 weeks than I did before robotics.
And that leads into a next question, but first I want to take a quick break to let everyone know that this podcast is brought to you by Yo-Yos. You own your own stories, a documentary storytelling company that demystifies cutting-edge technology with emotional human patient stories. If you've got a cool story to share, we can help you get it out there. So I want to talk about the future because I'm here to I want crystal ball stuff. So I'm a sci-fi nerd and I want to pitch
Yeah.
some
Same.
potential stuff to you. Yeah, and be like, okay, well, you're doing sci-fi, right? Like we're doing this is one step closer to Star Trek in my mind. It's like, okay, I'm gonna pull up the communicator and now I can see my
Yeah.
knee, I can see how what I'm doing. What is the number one biggest? And again, these are all personal opinions of you, an individual doctor, not of anyone else. What's your biggest prediction? It could be the next 100 years, 150 years, or even 10 years.
So we're seeing it now, and it's AI. It's AI in the robotic field. The surgeon is never, in my opinion, going to be replaced. The surgeon still has to have a role, and I don't think that the surgeon's role is going to be diminished. I think that the surgeon's capabilities and coupled with that, our outcomes will only be augmented as AI is introduced into the robotics platform. Um, Also, these robots they're big, they're not cheap. Um, However, I'm not going to discount the outcomes from it, but I do think that in time things are going to get smaller, handheld, VR. I mean, that stuff's already here. I think it's just not quite streamlined, and so I can do surgery with VR in the robot where I can use my hand and I can, instead of doing it manually, I can do the numbers with VR. I can. There's technology now where you can see through into a joint and it gives you a 3D map using VR, and you can place your components as you want it
Before surgery,
during surgery.
during surgery, because VR
Yeah.
is one of the places where, as an individual consumer, I would say I'm like an early adopter. I got an Oculus like 3.5 years ago, and I was, or maybe earlier than that, and I'm like, this is the future, guys. And I still am surprised how slow that adoption has been. But interestingly, medical is where a lot of VR is being used, like fully
Yes, it's
immersive.
it's in. I mean, we have it. I have one. How? I mean, I have one now in my locker at the surgery center. We use it. It's just not quite yet mainstream. And so I
Hmm.
think definitely in my career, it's going to be not only more mainstream. And when I say mainstream, I think the vast majority of high volume fellowship trained adult reconstruct joint replacement surgeons are utilizing it. As a tech, as things go by, we're starting to see some of these older surgeons who are not quite adapt to new technology, et cetera. They'll be retiring, and the younger physicians coming in with that have knowledge and or training or acceptance of where the field is going. Um, but also, again, making it smaller, making it handheld, making it easier. That quote by Elon Musk a couple weeks ago about, or months ago, about how surgeons are. Um, I'm going to misquote it, but essentially, good surgeons are not going to be relevant in 5 years. I don't agree. I think we're never going to be replaced. I think our skills and our abilities are going to be augmented with the technology around us to even make the field better.
Hmm. I think the difference is, will humans feel safe without a
Always.
doctor? Because when
I
you
mean,
said about
always.
like surgeons being replaced, my first thought was that movie Alien Prometheus, where she like gets into a surgery
Uh-huh.
tube and it like does auto surgery on her, which is like,
Yes.
it's just a horror movie because you're so scared seeing the computer just like zap her.
I
I
mean,
assume if you're
I
on a
love that
spaceship,
movie.
yeah, you do.
I mean, I love the whole Alien series.
Okay, we're gonna
I'm really
talk
looking
after
forward to the next one
this.
coming out,
I
and the whole
haven't seen
Predator series.
Romulus.
Oh, I just started that. I was on trip back from a work stuff, and I started. I didn't get to finish it, but maybe I'll finish it tonight. But again, I think it's going to be. We're not going anywhere. The
Hmm.
surgeon is still the surgeon, and going back to that question you asked about what patients fear or what may be hesitant, I think I've been a patient myself. I would want to know there's a surgeon in the room, and I wouldn't
Yeah.
want to completely entrust into a robot.
Yeah.
And so when I talk about robotics, I say I'm doing the surgery, the robot's assisted me. The robot's not doing anything except showing me numbers. There's no saw blade. There's the robotic arm is just a guide, and so I'm doing all the work. And I think that's where Mr. Musk, respectfully, might be a little mistaken that we are, surgeons are still a critical component of the field. And although we're only getting bigger and better, AI is going to really take over as we learn more from that.
So what does the AI do?
In my opinion, I think AI is going to make it so you press a button and it's just, so right now when I'm doing knee replacement, I'm making a plan. And so I take the knee and I move it and I take my points and I stress it. I'm checking the stability and it's giving me numbers. I think AI is going to get to the point where it's going to be press go and bloop, it spits it out. This is what you need to do to get the best knee.
Oh, like it's going to analyze all of the topography of
Yes.
my specific body and my joints and
Right.
whatever, like the
Right.
bone placement. Because turns out everybody's body is different.
Indeed.
Different factors, blood types. I don't know what goes into it. All right, I'm going to pitch you two more really random, like potential futuristic stuff.
Let's do it.
What do you think one day there will be a possibility that you'll like insert a knee replacement with like a needle and just like that could be cool. I know everybody talks about like reduced whatever, but like what if there's like a thing that auto pops up or I guess I'm talking also, I don't know. What if you could insert a knee that like flops up within just a needle without having to actually cut everything open?
I haven't thought about that. Just first thought, these implants are, they're made of cobalt chrome and titanium, and they're big, they're made of metal.
So no.
Unless
they're Terminator liquid.
Right, something like an alloy that just shapes the bone perfectly. That's a little scary, but
are they heavy?
Not much, no.
Oh, it's like a couple pounds? No?
Not even.
Oh, okay. But it's like
I've
sturdy
looked this
metal.
up before. I think in a full knee replacement on an average person, so not a very big size, which would be heavier, a very small size would be lighter. I think the average is less than a pound for both implants. So not heavy at all. But it's still cobalt chrome, big cobalt chrome clunk of metal on the femur and a piece of titanium tibia on the tibia. So, that's I'm going to have to think about that, where we might be. Hopefully, when I'm retired.
I hear about it for replacing. I hear about this for replacing the cartilage, where like people are gonna like insert stem cell cartilage, right? Like that would supposedly make your knee last longer. That's exciting to me. The other thing I wanted to pitch you, this is just an idea, is like the nanobots. So you're talking about like a smart implant. My thought was like, well, we have nanobots that go to my phone that be like, you have low iron, or like you have the flu, right? That are just like constant body tracking. Do you think that's going to happen?
I think we are probably closer to nanotechnology than recreating cartilage.
Really?
Yeah.
Wow. I love talking
to doctors. That's a bold statement, but I really believe that the way technology has just exploded and the way we're going, that's somebody is absolutely looking into that right now.
Lots of people, and they're actually looking at like nano scale cancer fighting, which I think is really cool. Like designing cells, and we're using RNA and like protein therapy. That's the coolest. That's the most Star Trek stuff. Is like there's like targeted gene therapy where we use RNA to like create a retrovirus that seeks the cancer, and I actually still don't understand it, but I think I'm like just cheering it on. I'm like, yay, go, sweetie, let's go.
Like, hurry. It's amazing. And as an adopter of technology, I have to assume that that's something that I'd be interested in. We're going to go for.
So you're like, I'd get the nanobots.
I can get behind that, but something about, call me a purist, but we're born with this amazing human body, and we get a joint, and that's the best you're going to get. So if it fails, the best option we have currently is to replace it.
Yeah.
And all these other modalities we've tried are either temporary measures or, well, they're really temporary, or they're actually just not successful. And we've tried many options in the past, including stem cell therapy or otherwise. And I just don't think we're there yet from that perspective, because I think the human body is more advanced than maybe we are able to do from a lab. But technology, as I've adopted it very quickly, has really shown that it's very easy to adopt, and it's getting so far better outcomes. But yes, there's got to be something better on the horizon. And I thought of it from a more micro standpoint or a very more narrow standpoint, that I think AI, smaller handheld VR, kind of stuff that we have now.
Yeah.
I haven't really given too much thought to the nanobot technology, but
I've just I don't that didn't I wasn't planning that. It's just like I started talking about,
no,
okay, I do have one more, which is we
yeah,
talk like it's very unlikely that in the next 5, 10, or even 50 years that we're going to not do this kind of replacement of joints. They like take a lot of pressure and wear, right? They're like
mhm,
they have to be really sturdy, and you can't just like insert
yeah.
something with a syringe. What about can you imagine yourself one day attaching an entirely new bionic leg to someone? Like a robotic, like androids, robotic, like, because I always joke with my friends, like, oh, we're going to be bionic, right? But what
You
if?
know, I do.
Yeah.
In the event of like something traumatic,
Hmm.
God forbid, an amputation, I do think we are absolutely getting towards that, and we have that to some degree. Some of the prosthetics we have that we've learned from both Gulf One and um, Desert Storm and Iraqi Freedom,
Hmm.
unfortunately, have really brought us to the forefront of that technology. And so a lot of those prosthetics now are robotic and really, really advanced. And I think it's only a matter of time before that's going to be correlated towards the brain. I mean, again, Mr. Musk already has Neuralink. It's only a matter of
Yeah,
time before those two things kind of get connected, and then you're getting, instead of, yeah. So I do think bionic limbs are
but it
something.
would make sense for trauma. Most people would not elect to just get rid of the whole leg beneath the knee
I
when they
would,
need a knee replacement.
I would recommend against personally, but yes, in the event that something had to be done, cancer, right?
Yeah,
Or
or a
severe
car accident.
infection or trauma, then I think that's definitely going to be in my lifetime, in my career.
Okay. Thank you for playing this game. Is there anything
I
else
love
you'd
it.
like to share with our audience before we wrap up the show?
I thank you for having me. I love the technology. I think it's changed my practice. It's opened up my eyes into where we can go, what we can do, and as we've discussed today, with the possibility of what holds in the future, I think we've only scratched the surface. So I'm looking forward to where it goes next. And thank you.
Well, and Dr. Gerscovich, thank you for being an early adopter and an example of somebody who's not afraid to do things that will better the life of your patients. Thank you for listening to Cool, Cool, Cool. I'm Cameron Kitt from Yo-Yo's. A huge thank you to Dr. Daniel Gerscovich for joining us today, sharing his incredible story and the stories of all of his patients. Check out the show notes for links to his website. And of course, let us know what you think of the episode online using the hashtag Cool, Cool, Cool podcast. Thank you.
Thank you.